We will now begin today's webinar. Today's webinar is titled Direct Care Workforce Strategy Center, State Technical Assistance Opportunities. Before we begin, some housekeeping items. All participants have cameras turned off and are muted. ASL translation is being provided on this webinar. CART is available on this webinar through the Zoom Captions feature. A brief Q&A session will be held towards the end of the webinar. Please use the Q&A feature to ask questions to panelists. Please also reach out to conference@ncoa.org should you have any technical issues during the webinar. The webinar is being recorded, and a copy of the slides will be available after today's webinar. We will now go over today's agenda, which includes an overview of the Strategy Center, a discussion of the DCW Intensive Technical Assistance Opportunity, a discussion of the DCW Peer Learning Collaborative Opportunities, and a question and answer session. And with that, I'd like to introduce Ramsey Alwyn, CEO of the National Council on Aging, who will begin today's presentation.
Welcome to today's call. I'm Ramsey Alwyn, President and CEO of the National Council on Aging. At NCOA, we believe every person deserves to age well. For nearly 75 years, we've worked to deliver the resources, tools, best practices, and advocacy our nation needs to ensure every person can age and live with dignity, security, and purpose. Like all of us, older adults and people with disabilities deserve to live in the place and community they choose. The direct care workforce makes that possible. But right now, we simply don't have the workforce needed to meet an ever-growing demand. According to the PHI team, between 2021 and 2031, we will need to fill 9.3 million direct care jobs in the United States. That's a level of demand we're just not ready for. But it's also the very challenge the Direct Care Workforce Strategy Center hopes to address. NCOA is honored to administer systems change programming for the Direct Care Workforce Strategy Center on behalf of the Administration for Community Living. We are leveraging our long history of leading cross-functional initiatives across many divisions of the government at the highest level. The center will be working directly with states to put the systems in place to revitalize the direct care industry so workers, people receiving services, and families can thrive. States working with the center will benefit from the tremendous expertise and commitment of 11 national partners who are all engaged in providing technical assistance, information, and research to support our joint goals for systems change. Now it's my pleasure to introduce Allison Barkoff, who leads the U.S. Department of Health and Human Services Administration for Community Living, or ACL. Allison performs the duties of the ACL Administrator and the Assistant Secretary for Aging. In her role at ACL, Allison provides executive leadership and coordination for ACL programs nationwide and serves as an advisor to HHS Secretary Becerra on issues that impact people with disabilities and older adults. Allison is a lifelong advocate for community living who has worked tirelessly at the forefront of national efforts to expand the home and community-based services that make community living possible for so many. She has appeared before Congress and the U.S. Commission on Civil Rights and has been part of countless coalitions of people with disabilities, older adults, and advocates, often in her role as a civil rights attorney. Allison, welcome, and the floor is yours.
Thank you so much, Ramsey, and hello, everyone, and welcome to today's call. Thank you so much for participating. I really want to start by thanking the Direct Care Workforce Strategy Center for hosting this call. As Ramsey mentioned, the Strategy Center is funded by the Administration for Community Living and operated by the National Council on Aging in partnership with more than a dozen organizations from the disability, aging, and workforce communities. At ACL, we know that the home and community-based services provided by the direct care workforce make community living possible. And the direct care workforce crisis is putting our progress around community living at serious risk. I know all of you from states who are on the calls today, I don't need to tell you the statistics about where we are in this crisis, but I'm just going to put a few out there. More than 3/4 of providers are turning down new referrals, and over half are closing services. And it's at a time when more people are aging, people with disabilities are living longer, people more than ever want to live in the community. But without this critical workforce, that will not be possible. So that's why ACL, together with our federal partners, started the Direct Care Workforce Strategy Center. We just felt incredibly strongly that we need to take action and create opportunities for partnerships, innovation, bold ideas, and the sharing of best practices, because we know so many of you are doing incredible things in your own states. We are so excited to have recently announced a number of new TA opportunities for states, and that really is the focus of today's call. And this really is coming from states themselves. We worked really closely with 3 of the Direct Care Workforce Strategies partners who are leading this opportunity, and they are probably many of your own close partners. That includes Advancing States, the National Association of State Directors of Developmental Disability Services, or NASDS, and the National Association of State Medicaid Directors, or NAMID. These state associations have heard again and again and again from their states that DCW issues are top priority and that help is needed. And while there are so many great things that states have been able to take advantage of with funding from the American Rescue Plan, we saw every single state has used ARPA funding to work on DCW issues. People are struggling with how to sustain those investments because ARPA is, as we know, sadly, one-time funding. So a key concept for the Direct Care Workforce Strategy Center and this TA effort is partnership. That means partnership among state agencies, aging, disability, Medicaid, labor, and workforce development, because we all have to work together to leverage every available resource. And of course, this also means partnerships with direct care professionals, people receiving services, and advocates. We are modeling that at the federal level, and I hope many of you were able to join our first kickoff call that was yesterday, where we had agencies across the federal government talking about our work together. I really want to thank our federal partners on this initiative: the U.S. Department of Labor, the Centers for Medicare and Medicaid Services, and HHS's Office of Assistant Secretary in Planning and Evaluation. I know there's a lot of great information that will be shared today, and I really want to encourage each of you to please consider applying for the opportunities you'll hear about. The technical assistance opportunities that you will learn about, I hope when you see them, will really resonate, because they were developed in response to what we heard from the state associations about what they have heard from you. These opportunities really reflect what we think would be most helpful to states as you're working to sustain progress currently underway to strengthen the workforce and make progress with the American Rescue Plan funding. We believe the direct care workforce crisis calls for leveraging every tool in our toolbox, and the TA opportunities we hope you will apply for encourage that collective action and collaboration across state agencies. And I'll just mention that at the federal level, each of our partners will be working with us to engage with selected states as appropriate. Next slide. So let me just give a really brief overview of the technical assistance that's being offered through the Direct Care Workforce Strategies Center. The first is the lowest level of intensity TA, which is self-guided technical assistance, involving opportunities like the Strategy Center webinar series that we kicked off yesterday, as well as partner conference sessions. Everyone can participate and attend these opportunities, and it doesn't require an application. So bottom line, even if you're listening in and you do not feel like you're willing to commit to the other opportunities, we have something for you. But because I hope many of you are states, I hope that you'll really be interested in the next two opportunities, which are by application only. The second is a medium intensity opportunity where there will be full group virtual sessions and a very oriented, action-oriented approach. And you'll hear more about that from the state associations in a minute. The third is really the greatest intensity TA, where we will be working with 5 to 6 states over a year, who will be selected from those that apply, and each state will receive 240 hours of virtual or in-person TA. So you're going to have to give a lot, but you will get a lot. My hope is that you can weave together a strong proposal for one or both of these more intensive technical assistance opportunities. We really tried to create these 3 tiers because we know this is an issue every single state faces, and we want to be able to reach as far as we can with the resources that we have. Again, I just want to emphasize that all of these opportunities are about forming collaborations and having access to expertise that can really translate into real change in your state and for the people in your state. So again, thank you so much for attending today's informational call. And I really hope by the end you are as excited about these opportunities as we are. And with that, I am going to kick it over to Martha from Advancing States. Martha?
Thanks, Allison. So happy to be here for this opportunity today. And I want to thank Allison in particular for your dedication to this issue. I know it's a real passion for you, and I appreciate the fact that you've been able to partner nationally with all the federal partners, as highlighted yesterday, but way beyond that as well, and really shine a light on this crisis that we have in America. I'm excited to be joined by Mary Sowers of NASDAs, Kate McAvoy of NAMED, and Ben Mays of Nashua. And because we know that only collectively and collaboratively will we be able to solve this problem. And that's why I'm so excited that our associations together are coming together to work together to partner with the states on some enhanced technical assistance. We know that a number of the statistics have already been cited, so I'm not going to repeat them. But the Department of Labor Occupational Outlook Handbook says that it's the #1 job that is most in demand with a 22% growth rate. So just imagine the urgency that we're feeling on this issue. One of the things that is a hallmark of trying to solve for this is we have to have a broader than just the traditional long-term services and supports programs working with this, which is why we're excited to be able to partner with our friends in the workforce agencies. So if for those of you that are my members, Kate's members, or Mary's members, I'm not talking down to you. I'm trying to explain some of the same technology and technical terms to some of the workforce agencies that are there. So what I want to do, first of all, is to explain that who we're trying to focus on are not the individuals that do this job in a nursing facility or another institutional setting. They're very valuable members of this continuum, but we're really trying to focus more broadly on those individuals that serve in the homes and in the communities. And one of the things that's pretty complicated about this is they have a lot of different titles for the same type of job. So they can be called direct care worker, personal care aide, a home health aide, and a direct support professionals. So if you hear any of us talk about those with different at different points today, we're all talking about the same kind of person. The workers, though, provide essential daily assistance to support individuals with disabilities, those that are older, chronic illnesses, And they help them to remain in their homes and communities rather than going into an institutional setting. They help to promote the dignity and independence for individuals. They really promote the quality of life. Most of us, if asked, would not want to spend our lives living out in a nursing facility or other institutional setting, but in our own home and in community. They're cost effective and the quality of care is also superior. And they support family caregivers. In many cases, the direct care workers alleviate the burden on a family caregiver, which allows the family caregivers to maintain their own health and independence. So with that, I'm going to turn to my colleagues and interview them a little bit about this exciting opportunity that we have to be working together. So first up is Kate. And can you share a little bit about why you were excited about this opportunity from the Medicaid director's experience? Just by way of introduction, Kate is the executive director of the National Association of Medicaid Directors. Kate?
Martha and all, it's such a privilege to join this afternoon, and we are not only excited, but just thrilled. I first want to say that we collectively recognize the DCW workforce crisis is urgent. It is stratifying at the highest level for all sectors that are involved, but especially from my lens for Medicaid directors who are looking for solutions that are pragmatic and are actionable. And I think that is what we're all about. I'm also incredibly excited about what Administrator Barkov referenced. That is the harnessing of energy, momentum, direction, and specific commitments that we see on behalf of all the federal partners. And we aim at the state level with this initiative to emulate what we saw yesterday. And that is the knitting together of all the levers and influence of all the actors that have, bearing on this. This opportunity for TA, we're specifically excited about because we know from experience that this requires dedicated space and time, candor, confidentiality to really allow people to connect across disciplines and also to both dream and specifically strategize. And finally, I just want to say, not least important is the opportunity to do right by the people who do this essential, this very demanding and also precious work, and also the people who rely on them for their services. So for all those reasons, we are just bursting with energy around this. And Martha, back to you.
Thank you so much. And Ben, for those that are my members, Mary's members, or Kate's members that may not be as familiar with your association, can you provide a little bit of an overview for us?
Thanks, Martha. Absolutely. So NASWA was founded in the 1930s, and since its inception has really been a convener of states around key workforce issues. Our organization represents state workforce agencies in all 50 states, DC, as well as the US territories, and our members are responsible for administering programs as varied as unemployment insurance, wage and hour laws, labor market information, and most importantly for today, employment and training programs. So here at NASWA, I have the pleasure of working with our Employment and Training Committee, which brings together state workforce development directors across the country to share best practices, work through common challenges, as well as advance innovations across state lines. So these are the state leaders who administer WIOA programs, registered apprenticeship programs, and increasingly a growing number of state-funded workforce programs as well. So at the end of the day, our members really can be meaningful partners in this work. So thank you so much for the invitation today, and really appreciative of the fact that you're including state workforce agencies in this important dialogue.
I think it's our pleasure and delight that you're able to assist us in solving this. Again, without the workforce experts, we're not going to be able to solve for this crisis. Mary, what unique benefits or resources will your members, do you think, gain from the enhanced technical assistance through the center?
Thanks so much for the question, Martha. And before I jump in, just want to echo the deep gratitude to Allison Barkov and her team at ACL and the team at NCOA for the opportunity to engage in this most important work and for our partners at Advancing States, NAMD, and NASWA. I think one of the things that our members are so excited about is the opportunity to have real dedicated cross-systems intentionality to really dive deeply into the issues that are really so ubiquitous across the HCBS service delivery system. In addition to the extensive technical assistance that states will be able to obtain up to 240 hours across those system partners, they'll have access to specialized coaches and really an amazing array of subject matter experts with deep end knowledge of workforce and state systems. The other thing that's really appealing about this effort is that it will be so highly individualized for each state, meeting them where they are and recognizing that every state's in a different spot across their long-term services and supports and workforce sectors, and really leaning in heavily to the state's very specific ecosystem. We also are especially excited about the state's opportunity to do deep dives on specific pivotal issues related to recruitment, retention, and support of the essential direct support workers, without whom, frankly, the promise of community living is really out of reach for so many people with disabilities and folks who are aging across the country. So again, I think there's a lot of opportunity here for our members to link arms across systems to really lean in heavily. Thanks, Martha.
Mary, thank you for making that point too about meeting states where they are, because I think we've already started to get some questions about, I'm a little bit more advanced, or I'm just starting, can I apply? And the answer is yes, all states can apply regardless of where you are. We will meet you there. Ben, what do you think the value would be for your members partnering with not traditional workforce agencies?
Yeah, of course. So first and foremost, I think it's really important to underscore that our members recognize that the direct care workforce is a priority. Back in September 2022, we did an informal pulse survey of a subset of states, and I think the findings were really telling. First, every single one of our members recognized that there is a real direct care workforce shortage in their state, and that the shortage is significant. Second, our members almost across the board mentioned that they currently have a workforce development program or initiative in place focused specifically on the direct care workforce. And a strong majority of states also mentioned that they're actively partnering and engaging with another state agency, such as a Department of Health, on these initiatives. So some interesting findings from that. But I think, going forward, there's really a strong recognition that these challenges obviously aren't going away anytime soon. And the direct care workforce shortages are only going to grow in the coming years. So with that said, working across systems, across agencies is really vital, really critical. And I think just a helpful kind of parallel to the direct care workforce shortage that's worthwhile to highlight is, right now, a lot of our members are really focused on implementing the bipartisan infrastructure law, which is creating a huge surge in demand in sectors like construction. And unsurprisingly, a key part of that work is partnering with state departments of transportation. And I think when you look at another sector like the direct care workforce, right, these critical occupations, that partnership, that collaboration across agencies, across systems is absolutely vital, so that you can truly understand the acute needs of employers, the acute needs of workers, and the particulars of the broader workforce ecosystem as well. So,
Ben, thank you so much for those insights. And you brought up some additional partners that we're going to need at the table in order to solve for X, which include, Department of Health, the Transportation Department, and Housing. So indeed, those are all critical to the success of this initiative. I'm going to turn it to Kate and just ask if you can outline some of the key objectives or goals that you think for the enhanced technical assistance for addressing the workforce challenge.
Yes, just leaping off that last point around taking an inclusive and encompassing approach, our foundational objectives with this TA are first, to engender close and enduring working relationships among all the leaders in these different strands of the work that we believe at the core must be knitted to achieve aims, because this is such a multidimensional set of issues. We also want to underscore a broad lens. We've had many strands of prior work, particularly focused on wages or public recognition of the work. We're looking to amplify that. And again, just take that very big scope in mind in terms of tailoring the work across those who have instrumental touch on it. We want to move toward the aim of improving the supply, the retention, and the economic security of the people who do this work. So that's really the bigger picture piece we want to never lose sight of, and particularly as it is informed by the people who do the work. And toward that end, we are going to be looking at some components of the TA on which Mary touched that we feel will be very instrumental here. The first is a formal readiness review that will really assess your position on some pieces we feel like are important requisites for this work. And you could be at the early stages, you could be at advanced stages. As Martha said, you're welcome to pursue this set of opportunities. So that self-assessment, including but not limited to the engagement with DCWs, will be really important, as will a selection from a number of important topical focus areas, and kind of braiding that attention to the staging and the relationships, as well as enhancing your work in one of those areas, is really the core, the meat of the TA. So thanks so much, Marcia.
Oh, thank you. And finally, Mary, what strategies or approaches will the technical assistance, do you think, bring so that we can foster better collaboration and knowledge sharing among all of the players?
I think one of the most wonderful things about this intensive TA opportunity is it's in its intentional design to really leverage the strengths of each of the individual partners within the state government who have a role to play in really enhancing and bolstering the recruitment, retention, and frankly, the real honest support of direct support professionals, elevating their stature. Many of our members are gauging their status in the IDD workforce using the NCI State of the Workforce Survey, but they know that for further progress, they're going to require partnership and really the need to link arms with sister state agencies. The built-in features that Kate just discussed will really allow for tailoring within states, because we know every state's in a different spot, but there are also differences across the states and within the states, across the various systems that support people with disabilities. And so for our members, we think this just provides a wonderful opportunity with their essential sister agencies to sort of foster those relationships and hopefully put down strong foundations so that the work put in motion through this intensive technical assistance can really transcend any particular person sitting in a given seat within a state government, but really institute long-standing practices that can foster ongoing attention to recruitment and retention efforts. So I think lots of great things for the states to gain from this work. So thank you, Martha.
I think you can tell how excited all of us are about this opportunity, and we hope that you are as well. I'm going to turn it to April, who is our Senior Director over this project, and she's going to briefly go through some of the nuanced stuff that we didn't talk about the application and what you'll get for once you apply for this. Thank you, guys.
Thanks, Martha. You can go ahead and go to the next slide. Thanks. So as Martha said, my name is April Young, and I am the Senior Director of Strategic Initiatives at Advancing States, and I'm helping to coordinate the intensive technical assistance for states, and we'll go into a little bit more detail about what all that includes. So part of what makes this TA opportunity so unique, and what Martha and Allison and others have alluded to, is the cross systems and cross agency aspect. So on this slide, we have a list of required partners. We've got at least 3. So the state Medicaid agency, state entity responsible for HCBS waiver programs and populations, and often that's more than one agency, and workforce development agencies. And you'll notice it's not focused on any one waiver population. We have multiple listed here. And then on the other side, states have the option to pull in other partners if they want. It's really up to the state. And that could include agencies like vocational rehab, Education, transportation was just mentioned earlier, housing, aging and disabilities networks. It's really up to the state and their project. Next slide, please. So this slide includes all the individualized support available to states as part of the intensive TA opportunity. And that includes a dedicated TA coach. So each state will have a coach assigned to that state, kind of like a project manager or a staff extender, if you will, to help the state walk through an assessment process and critically think through a work plan for the state, thinking through those timelines, who needs to be at the table, specific actions and activities that will need to be considered, those kinds of things. We also have subject matter experts or SMEs available to states separate and apart from that coach who can assist state teams by providing specific information relevant to that state's project. They can help develop tailored materials or research certain questions or topics. And then there are up to 2 site visits included, at least one, up to 2. And like much of this TA opportunity, again, it's up to the state's needs and preferences, how they want to style that. You can see the value in a state wanting 1 visit in the beginning and maybe 1 visit at the end, kind of rounding out activities, or maybe 1 prolonged visit, kind of in the middle of activities. It's up to the state. We have tools available to states and coaches, such as a work plan, project management tracking tools, driver diagrams to help define project aims, and also multiple templates for direct care workforce advisory boards, which is another requirement of the TA that we will get to in a minute. And then the last support we wanted to mention is that there are supplemental resources available that will be considered on a case-by-case basis. That could include something like SMEs for a particular project, like funding for a direct care worker training, or something outside the scope of the experts that are already involved. And then by the end of the TA period, each state will receive a report of the work that was conducted by and between the state and their assigned coach and SMEs during the project period. Next slide, please. So for the entire group of 5 to 6 states, up to 6 states, just to really support peer-to-peer learning, we will have quarterly meetings with the entire state cohort, monthly email updates about state efforts, and access to promising practices housed in a unique library that only participating states can access. So really promoting opportunities for crosstalk among the state teams and learning what other states are doing, identifying common barriers, and celebrating shared successes. Next slide, please. So this is the timeline that we're working with, and I have a feeling that time is really going to fly by. It's already March somehow. The application, as you hopefully know, is open through March 25th for states to indicate interest. We will interview selected states and make final decisions about the cohort in early April. Coaches will be assigned shortly thereafter, and states should expect to have kickoff meetings mid to late April. The first phase of the TA, the readiness assessment that's kind of been talked about, will go through the end of June, those first kind of 3 months. And part of the reasoning behind that chunk of time is just to make sure that all parties that need to be at the table are at the table. We mentioned earlier that cross-agency collaborative nature of this project, and understand that sometimes that can require a little more time for planning when you have different agencies trying to coordinate schedules. And I'll talk about more with the readiness assessment aspect later on. We have an example of an on-site visit in July shown here, and also direct care workforce advisory board meetings happening every other month through the end of the technical assistance period. Not to imply that the board meeting would have to end at the end of December, but just to show an example of cadence for those meetings. There will also be an in-person meeting at the HCBS conference in Baltimore, Maryland in late August. I think we're calling that a symposium. And a quick shout out for the direct care workforce intensive at the conference as well. So there will be lots of workforce at the conference. The lead from every state will meet monthly with the leads from the other states. And then lastly, we have a final meeting to plan for next steps and kind of close out activities at the end of December. Next slide, please. So a little bit more about that readiness phase and the topics that we're including for this TA opportunity. Over the first 3 months, we want to make sure the team lays the groundwork for a successful initiative. And that work could include determining the state team, establishing roles and roles for partners, and deciding when and how often to meet. gathering any necessary documents or existing information that would be helpful for planning. That could be ARPA plans and quarterly updates, contact lists, a state workforce plan if one exists already. Walking through and completing a self-assessment, that's something that the coaches will be able to help with. Utilizing those assessment results and gathering input from team members for the technical assistance work plan and thinking through, again, those activities and the timeline that will be needed. Any risks that might be encountered and how to mitigate those, thinking about key goals and milestones. Also thinking about the Direct Care Workforce Advisory Board or a group similar to that comprised of direct care workers or family caregivers. And if the state already has a group like that, great. And if they don't, again, we have templates and tools to help states get that group off the ground. And then just thinking through any additional technical assistance to support readiness activities, whether that's data sharing agreements or drafting MOUs and getting that routing process started. Next slide, please. So these are the three main topics for states to choose from, and you'll see these in the application when you go to apply, if you haven't checked that out yet already. We'll walk through some examples of these in the next few slides. We've got the first one. Oh, thank you. The first topic is about leveraging and aligning workforce development investments and strategies with state HCBS program workforce goals. So we understand that state workforce departments might not always be at the table when Medicaid and aging and disability agencies are discussing the direct care workforce. So what better time to bring everyone together, bring those agencies together to partnership and tackle this issue that we know is so important to all of these states. We have examples here that include engaging with workforce boards and workforce planning processes to make sure the direct care workforce is included and prioritized for annual employment and training dollars as a high growth industry. Examining and developing career pathways for the direct care workforce and jointly prioritizing across higher education, workforce development, and HCBS systems to ensure alignment in those requirements. And then creating policy guidance across multiple agencies, again, that cross-agency focus, reviewing education, workforce, Medicaid, aging disability funding for blending and braiding to support recruitment and training and retention strategies. Next slide, please. The second topic on value-based purchasing is one that we noticed was starting to bubble up in a few states and thought it might be of interest to others if they had some extra support and technical assistance. And by value-based purchasing, we're basically just talking about providers engaging in some sort of activity that results in improved quality for the workforce and reward for the provider, whether that's tracking certain data and submitting it to the state or retaining a certain percentage of direct care workers, for example. We included all aspects of creating a value-based purchasing initiative in our examples, and even something as simple as determining the design of the value-based purchasing initiative, what measures should be included, what data is available for those measures, where do the data gaps exist? We know there are plenty of those when it comes to the workforce, the direct care workforce. And then what sort of incentive for the provider and how that would be sustained. Next slide, please. I think this is just more examples continued, some of which we've kind of mentioned on the previous slide, but that last one, evaluation of value-based purchasing options, could look like brainstorming across agencies about which value-based purchasing model might be the most impactful, and then evaluating those to see which one to move forward with or pilot, and then creating plans to implement, even if those plans extend past the end of December. Next slide, please. Our last but not least topic, non-monetary compensation strategies, includes instituting a peer mentoring or support program, establishing support hotlines for those like what do I do now instances, or am I doing the right thing moments, childcare stipends for direct care workers, tuition reimbursement programs, or establishing a Medicaid benefit specifically for direct care workers. And as you can see in these examples across all three topics that I've talked about, we have very specific examples kind of in the weeds or a little more high level, more planning based, and just focused on putting mechanisms in place. And I'll just echo what the other speakers have said, is that we don't want states to think this is only for states that have just started or only for states that are more advanced in their workforce plans. It's really for every state in between. Next slide, please. Just wanted to close out with some possible outcomes. Just to give a complete picture of the technical assistance project, outcomes could look like states that have established direct care workforce advisory boards, have developed a charter, have met twice by the end of the project period. completing those MOUs across all participating agencies, creating the value-based purchasing model strategies and action steps that are in place to prepare for implementation. So things like that as possible outcomes. And then our last slide is contact information. And I'll just say I'm the intensive TA contact. So if you have any questions, please feel free to email me. And with that, I'm going to turn it over to Hope Glassberg with the Rockingstone Group to talk about the last TA opportunity, peer learning collaboratives.
Thank you, April, and good afternoon, everyone. Really excited to share a bit more about peer learning, the peer learning collaborative opportunity. I'm an advisor with the Rockingstone Group. We're a health policy firm with experience in state and federal policy, healthcare provider, payer contexts, and technology companies, and want to thank the prior presenters, ACL, and the National Council on Aging for putting together this conversation today. We want to move to the next slide. So just to provide an overview of what the intention is with these peer learning communities or PLCs, there will ultimately be 2 to 3 PLCs chosen. And as the name implies, the main intent and focus of these groupings is to help states as peers to learn from one another, share best practices and how challenges have been overcome to make progress on defined systems change milestones that are unique to each participating state. We imagine that each PLC will have up to 6 states at a maximum, with meeting 1 to 2 times per month for up to 6 months. And you've heard just now about a more intensive option. This is the medium intensity option, if you will. We know how busy all of you are on this webinar and in states and have many competing demands. So we imagine that this intensity may be a good fit for states that may have less bandwidth to devote to the opportunity or want to focus on sort of the peer learning component. So states that are applying for this option are also asked to rank their preferred topics. So I'll run through that in just a moment. And the anticipation is that we'll select 2 to 3 of those final topics based upon interests. Next slide. I'm not going to read this, but I will direct you all to page 11 of the application, which runs through these topics in some detail. I will say that we sought to, just as with the intensive TA topics, be really responsive to what we've heard from the field and what we've heard as key needs and areas of interest. We've sought to be both specific enough so that participating states can pick topics that resonate with what is of most interest and urgency to them, while still offering enough latitude in the types of topics that are put forward so that states can define what this means in your unique context. Next slide. In terms of what participation will entail for PLC states that are joining these PLCs, there will be virtual convenings that will happen 1 to 2 times per month over that 6-month duration. And what we anticipate is the Rockingstone Group will be facilitating those conversations. So it will be a structured meeting, and it will be an opportunity for states both to learn from among each other, but also from subject matter experts, including folks from the organizations that have previously presented on this call, along with the National Council on Aging, PHI, the University of Minnesota's Institute on Community Integration, and the Social Policy Research Associates organization. So we'll have a broad bench of subject matter experts that will be available to both participate in those convenings. And we'll also, if you see the second piece of participation here, provide more limited support than the intensive option between meetings. And we'll really try to do some great matchmaking between SMEs and states that are participating in topics. Next slide. In terms of expectations for states that are going to be participating, again, on page 11 of the application, it goes into detail about what these expectations are. But along with the concept of this being a more medium intensity option for applicants, you'll see there's sort of fewer expectations, but nonetheless, a consistent and robust set of ways to make sure that it's worthwhile for participants. So we ask states to designate leads to be engaging in the PLCs. That might include relevant state partners, depending on what topics selected, and obviously, of course, participating in the PLC meetings, and then making progress along selected goals, in addition to participating in a meeting at the end of our PLC experience. Next slide. We thought it might be helpful for listeners to have a sense of what a concrete PLC topic might look like, just to add a little bit more shape and flavor to what this could look like in practice. So I will say that the example that we're sharing here is very much not an officially selected PLC topic. However, if this is very compelling to anyone who's listening in and something that you've been thinking about, by all means, feel free to reflect this idea. But I did just want to share that this is really for example purposes only at this stage. So here we describe a hypothetical state that might want to launch a new apprenticeship program, collaborating with local high schools across the state, and the specific focus of the apprenticeship program being on cultivating an interest in direct care workforce careers and providing experiential learning. So this program in this hypothetical state would be jointly run by various state agencies that have oversight both over healthcare matters, but also workforce. And so this state is really thinking about both how to design this program, but also how it might integrate with existing apprenticeship programs in the state that may or may not relate to healthcare. Next slide. So coming out of their PLC participation, just to be, again, very concrete about what might happen at the end of a PLC, the types of systems change outcomes that we're hoping participants will realize through joining the PLCs. They may develop sample job descriptions that enable the state to quickly hire for, say, a high school liaison that might work and collaborate with schools across the state. Another systems change output could be cooperative agreements across those state agencies that I mentioned. And yet another really concrete outcome could be drafting an outline for or components of a curriculum that would be involved in this new apprenticeship program for the direct care workforce interested who are in high schools. And we'll be working with the states to develop those types of milestones and tailor what they have in their application, putting it into a work plan and a timeline so we can all help each other realize shared goals. So speaking of timeline, the front part of this timeline, I'd say much of this timeline is quite similar to the intensive TA timeline that April walked through. Similar sort of timing in terms of when the application opens. And as I mentioned, we'll be asking applicants to rank their preferred topics, and we'll use those responses to in turn finalize the groupings, the cohorts, the topics, and so on. We'll engage in some type of pre-session outreach just to get to better know our state partners and share a little bit more about what will be touched upon in the PLCs and how it will work. We'll then move into a monthly cadence, 1 to 2 times per month cadence for the sessions, culminating with a closeout and next steps by the end of the year. So I will stop there. We're really excited about this opportunity and happy to answer any questions. And April, I will turn it back to you.
Thanks, Hope. Yeah, if you have any questions, please drop those in the Q&A and we'd be happy to address those while we're all here together. Any that we aren't sure of yet or can't get to, we will be putting those into an FAQ document. I believe that will be shared on the center's website. So wanted to see, we had somebody ask about who's eligible to apply. And just wanted to reiterate that the Medicaid agency, the agencies responsible for HCBS waivers and workforce agencies are all required partners. Can states apply for both TA opportunities? I believe for the application, it is you have to select one or the other. Does anyone from NCOA want to back me up on that? Doesn't mean you couldn't submit 2 applications if you wanted to.
I think, April, that we decided that they could apply for both, but they would only be selected for one.
Yes, this is Hope from the Rockingstone group. That's my understanding as well.
That's correct.
Thank you. We also had a question from Leo. Can someone speak to the significance of TANF to the direct care workforce? Our state is currently looking at how workers' benefits fall as their income increases, and so far have been mainly looking at Medicaid eligibility. And I think that is kind of getting at that benefits cliff issue where people may not accept a higher position or more a higher hourly wage because their benefits would fall off. And that is something that we have heard as a concern in many states and would be a good example of something for a state to work on with this TA opportunity. I will open it up to our other speakers if there's anything else you guys would like to add.
No, just April, that I had added in the chat that we can share what some of the other states are working on as we go forward on the benefits cliff and the calculators for benefits cliff.
Okay, thanks. The slide deck will be shared, will be posted with the recording. Oh, how will people with disabilities and older adults be able to participate in this process? I wonder if that's a good opportunity in COA for you to talk about the advisory group, the advisory committee. Just thinking out loud, states can also kind of, when I was talking about those voluntary agencies, can reach out to stakeholders, people with disabilities, older adults, and they can be part of the process as well.
Hey, April, this is Allison, and if I could just add.
Of course, yes.
Okay, great. Thanks for asking that. And again, I saw a couple people asked about engagement of people, direct support professionals themselves and workers. And I just really want to emphasize, to add a little more to what April said, we are in the process of putting together an advisory committee to inform the entirety of this work. That will be primarily people with disabilities receiving services and direct care workers. So that is one piece. And then in the application itself, it does talk about ways that the state entities will be engaging stakeholders as they are implementing some of these strategies. So I think while the TA is targeted to state and state activities, as I mentioned at the top, the collaboration with advocates, people receiving services, and direct support professionals is really critical to what we're doing.
Thanks, Allison. I have a question from Dara. For states utilizing managed care, can MCO workforce personnel participate in those teams receiving the TA? That is an absolutely yes, 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 they can. Can we talk to all the people who are on this webinar today as we develop an application? Yeah, our emails are shared in this PowerPoint, I believe, and please feel free to reach out to me for any questions about the intensive state technical assistance opportunity.
And April, I see that someone asked where the website is. I'm going to put in the chat to everyone. We're really excited to have launched this, but if you go to acl.gov, you can find it there, or acl.gov/DCW Center. And there's a lot of resources there. And if you click on technical assistance, you'll be able to find out about all the opportunities.
Thank you. And Jessica has also dropped in the chat directcareworkforce@ncoa.org for questions as well. Is this a one-time opportunity, or do you think it will be ongoing? Hopefully it will be ongoing. I believe it's planned for a total of 5 years, but this is our second year. So yeah, more than one opportunity. Okay. Oh, Renita Polk from California. The intensive TA opportunity has requirements for specific state entities that must be included. For example, the state Medicaid agency and entities responsible for HCBS waiver populations. Are there specific entities that must be included for the PLC TA opportunity? Hope, would you like to address that question?
Sure, I can do that, and then Allison or others, if you want to jump in, by all means. We don't have quite those same parameters, I'd say, for the PLC. With that said, I think it would definitely be smiled upon to have that kind of robust participation, especially depending on what topic is selected. For example, if a topic if the topic around facilitating cross-agency participation is selected, having that kind of participation would be welcome, but I think it will be more important to be able to speak to the requirements of whichever part of the state is applying that are outlined on page 11 for the PLC, and we won't have that specific expectation for those applicants. And Allison, please go ahead.
Allison, I'll just add, So put a little competitive edge in here. We only have so many slots, and I think really across all of these concepts, there are many that will require multiple partners. So I think please come up with your strongest team around these issues. And as Hope says, really look at for the learning collaboratives, who needs to be at the table, and actually who, if they're at the table, would make the project better. And I think we would really, really encourage that.
We have a question. These are great questions, by the way. I'm so glad we have with this interaction. I'm curious how many people from a Medicaid agency would be needed to adequately cover a project, and from what specific units? So that specificity question is going to depend on the state, but something we do want to emphasize is the leadership buy-in and kind of sign off on some of this work, and that they would be kind of continually throughout the project involved somehow. There is a state lead that each state team will have, and I think it's estimated around 10 to 15 hours a month that that state lead would spend on this project.
April, if I could just wrap around you, this is Kate. You answered that beautifully. Just building on that, I think what April is getting at is there are different structures for Medicaid. Some are more encompassing of HCBS services than others. So I think we encourage you to think about that functionally. Again, it's the same rubric. Who is best situated from a policy standpoint, from a reimbursement standpoint, from a standpoint of the kind of systems connections that could engender this work? That will vary across the country, but again, would also key from the particular areas of topical focus that you may select in the TA, and there are three important opportunities there. The first is the nexus to the workforce boards and really knitting together that work. The second is value-based payment approaches, and the third is really amplifying the more typical focus on wages to look at non-monetary aspects of compensation and economic security for DCW. So thinking about that from the standpoint of what would be most appealing for your given state or territory to focus upon, I think that that would leap off and inform, who would best be situated in the Medicaid agency.
Thank you, Kate. So well said, as always. Is there info on the NCOA website about the advisory committee? It looks like Jessica is responding to that question.
And April, I'll just jump in on that, we have rolled out a bunch of things in the last 2 months. And that's one that, keep your eyes on the website, more info coming on that quite soon, but it is a really important part of the work that we're doing. And I'll just mention that, we were able to do this because Congress decided this was an important issue and was willing to give us funding at the end of the fiscal year. And so we are trying to just move things as quickly as we can, knowing there's just such a dire need in the states. So keep looking back. This is just the state opportunities we're talking about here. But as I said at the top, we are going to have a lot of other opportunities that are open to everyone. I'd also encourage people to go to the webpage. One thing we were excited to announce as we announced these opportunities was the curation of resources on the webpage. There's a lot of great stuff from across half a dozen federal agencies and a number of key outside organizations, really organized for you. We're going to keep building up that resource library, but really encourage you to check that out too, and keep checking back for more information as we launch new pieces.
Thank you.
I think we have time for one last question.
Can the application be downloaded to promote collaboration? And I know you can start the application and save it and come back to it. Is it able to be downloaded though? I actually don't know.
If you email the email that Jessica just put in the chat to everyone, directcareworkforce@ncoa.org, we can provide you with a downloadable copy.
Got it. Well, thank you again, everyone, for attending. Thank you for your interest in these opportunities and for all of the interaction. We really appreciate it.
So this concludes today's webinar. Please contact us again at directcareworkforce@ncoa.org with any questions. And this session will be recorded, and the recording and the slides will be posted. Thank you so much and have a great day.